Time now for COVID-19 diaries. Stay with me. Don't go away.
COVID-19 Diaries.
COVID-19 Diaries.
COVID-19 Diary.
All right, today's the 4th of May 2021, and the world has recorded 154,212,688 coronavirus cases. Now, 132,373,336 people have recovered from the virus. Unfortunately, 3,227,828 people have passed away. Rest in peace to all gone souls and condolences to all bereaved families out there. Let's proceed now to COVID-19 on the continent of Africa.
COVID-19 Africa. COVID-19 Africa. Daily updates.
All right, today, the 4th of May 2021, it's a Tuesday. Africa has recorded 4,618,502 COVID-19 cases. 4,147,872 people have recovered from the virus. Sadly, 122,873 people have passed away. Let's be safe. Let's continue to adhere to all safety protocols so we can stop all of these mishaps from happening. Now, so the director of health at the African Union is saying that India's COVID crisis is a wake-up call for Africa. Now, the calamitous COVID-19 outbreak in India is a wake-up call for Africa. That its governments and citizens must not let their guard down. The Disease Control Agency of the African Union has warned. Now, African nations generally do not have sufficient numbers of healthcare workers, hospital beds, or oxygen supplies, and the continent of 1.3 billion would even be more overwhelmed than India if cases surged in a similar way, said John Nkengasong, head of the Africa Centers for Disease Control and Prevention. That is Africa CDC of the Africa Union. And that is absolutely true because the cases in India is really getting out of hand. No hospital beds, oxygen supplies are in short. And people are dying. People, loved ones, families are losing their loved ones. And that is actually very, very chaotic, I would say. And recently, they actually called on the Indian army to come and intervene because the situation has really escalated that bad. The thing is, it's not about letting our guards down. What are we doing, to get our own remedy? Because per what is going on, the intellectual property and what those who actually invested in the research and coming out with the cure, they are not actually letting go or giving us the steps that we also need to do our stuff. So what is the plan B? Well, let's see how that goes. In our base Ghana, they're trying to see how they can go about it in terms of trying to produce a vaccine here in our base. The heads of most of the biggest pharmaceutical companies met the presidents, and they had conversations on how they can actually see what they can do. Well, that is in a pipeline. Let's see what that happens, and hopefully, maybe something good would come out of that. The show is Africa Daily on Africa Global Radio. For more updates on COVID-19, log on to our website. And let's get on now to the next bit, and that is the big question.
The big question.
The big question. The big question.
As I said, we're still marking or observing World Press Freedom Day, and that is our theme for the week. So we're asking you, how would you rate press freedom in your country on a table of 1 to 10? So 10 here being fantastic, 1 being very poor or poor. How would you rate? How would you rate press freedom in your country? So yes, is it 10 being fantastic or 1 being poor? All you need to do is share them with us, share your answers with us. Of course, if you have other reasons why you chose any of this, Tell us on our Facebook page, Africa Global Radio, or on Twitter, AF Global Radio. Use the hashtag The Africa Daily Show.